So good morning, chat. So today we're going to talk about the popular question of whether a health practitioner, physician, nurse practitioner should in fact be able to date their patients. So the obvious answer to that is yes, obviously we can. I think it's fair that you get up in the morning and potentially jump into your douche canoe and make your way to work, maybe stopping along the way at the local Tim Hortons or Dunkin' Donuts and picking up a turd muffin, and then making your way to your practice where you can select a partner and date them potentially that same evening. Hopefully you're picking up that I'm being a little bit facetious because this is an absolute hard no. You should not do this. There's actually criteria for it, and it sort of shows you how they try to protect this from happening. I can't remember what the data is for my specific college, but my wife's a psychotherapist, and I believe her college recently went from a 3-year gap between patients before you could actually get into a relationship with them versus now to a 5-year gap, I believe. And the question becomes, why is that so important? And what you have to recognize is that the doctor-patient relationship is not a normal relationship. The patients need to be completely vulnerable, completely honest. And so you create this power dynamic where the doctor has all of the information, all of the power, and it's really not fair to the patient if you think that you can take that and expand it to a normal relationship and move forward like you would in other circumstances. And if you're sitting there and thinking to yourself, I don't really appreciate that power dynamic, I just don't think it really exists. I'll give you an example, one of many within my career to demonstrate where that power example comes in. So about 25 years ago, I'm about 6 months into my career, when I come into the room in a clinic setting to see this very nice middle-aged European woman who has a couple of complaints, one of which is an actual breast issue. So after taking appropriate history and talking to her further, I realized I'm going to have to do an exam. So I explained to her that I needed to put this gown on to get on top of the bed, and then I'm going to potentially examine her. So I should stipulate, like a lot of Europeans, this is a woman who probably spoke 4 or 5 languages, English being her last one. So comprehension was a bit of an issue, and while she did relatively well, explaining things took a little bit more time, and there was some issues that she probably quite didn't understand. So after I give her this information, regrettably 2 things happened. One was I realized at that moment that I needed to make a very quick note about one of the secondary issues that she had. So I was delayed in the room by about 5 or 10 seconds. The second issue is, unfortunately, this woman was the quickest changer on the face of the earth. So while I'm sitting at the desk and I'm actually making this quick note, I can feel somebody encroaching on my personal space. And I look up, and there's this European woman, half naked, so naked from the waist up, trying to sit on my lap with this look of absolute horror on her face. So very quickly, I pushed my rolling chair back, and I'm like, no. I said, I need you to put this on, and I grabbed the gown, put it over top of your actual top, and sit on the table. And immediately, a look of complete, surprise and sort of relief floods over her face. She now understands. I exit the room, and then I come back in and complete the exam and whatever else we had to do. We'll have discussions about whether it's appropriate to sit in the room when a patient's changing. Short answer is no, that is not. But the reason I bring this up is this patient understood that I said, take your top off, sit on my lap. And despite the fact, by her horrid expression, that she knew that this was absolutely wrong, she was actually going to do it. And it just shows you how the power dynamic there is something that is not normal. And this is why you have to respect that, realize that patients are vulnerable, and it is not a place where you should be looking for potential partners. It is not a place where you should be picking up any type of dating sort of information. So digest that for what it is, and we'll have other pearls and anecdotes as we move forward. All right, take care.